Greetings to the Minister of Higher Education, greetings to the Vice Chancellor, Professor Sibongile, greetings to everyone listening to me, all protocols observed. And it's an absolute honor for me to say a few words on this momentous day. The dream of South Africa is to build a healthcare system which speaks to our communities and builds easy access of healthcare system to our communities. And it can only be possible if we build strong health infrastructure in rural provinces, in our rural areas. That's where the need is. That's where the population is quite underprivileged and needs access to easy healthcare. It can only be possible if we build strong skills, strong healthcare system, and strong professionals in the healthcare industry that are willing to serve in the rural South Africa. When I did my PhD, my topic was retention of healthcare professionals in rural South Africa in order for us to build infrastructure in this country, in the rural healthcare system. And one of the premises of my study and one of my outcomes is building economic dividends or building skills of healthcare among students coming in from the rural areas, specifically like Eastern Cape, which is completely a rural province, and establishing a medical school, a second medical school that can give an opportunity for rural students to get into healthcare industry. The chances of rural students retaining back into rural areas and serving our rural population is extremely high. And I unquote my own study in this, of my PhD results. Hence, for us, this is an absolute momentous day to see a medical school being built in rural South Africa, in a rural province, by Nelson Mandela University. We are extremely grateful to you, Prof Sibongile, and a special thanks to our Minister of Higher Education, without whose vision these momentous things are not possible. We are on the right path. This is the right way of how we will build a healthcare system that will speak to our communities. When South Africa is embarking on this ambitious and a very important national health insurance, which is built to serve the most disprivileged or underprivileged people in our country, it is built through a system where we will build a large number of our own healthcare professionals in order for them to be able to serve our communities, right in access to our communities. So Nelson Mandela University, I fold my hands and I say thank you to you for a perfect direction, for a brilliant job. And I wish you all the success in order for you to build this infrastructure of building the next generation of people from underprivileged backgrounds, from rural backgrounds, and giving them opportunities to build them into healthcare professionals that can only be for the best of our country. I am aware that through this initiative, there will be many more institutions in our rural South Africa that are thinking towards building more medical schools. And that is only how we will build health infrastructure. COVID-19 is one of the brutal reminder that infections will keep coming. Why this is a phase where we're going to be facing new invents of bacteria, microorganisms. Not to forget, our non-communicable diseases are on the rise. As in parallel is our communicable diseases. And the only way we can fight a biological threat or microorganism threat is by building a strong healthcare system, which is only possible through our own university system, through building medical schools and building perfectly brilliant healthcare professionals. With that note, I wish lots of success to Nelson Mandela University, and I pledge on behalf of Higher Health that we look forward to partner and work with the medical school in building more researches, in building more understanding of easy access of healthcare infrastructure into our communities. Thank you very much. God bless you, and God bless South Africa.